Good morning, Beeville. This is Cindy Clark from PAC-B TV. Good morning, everybody. This morning I have Dr. Eric Croucher from Upstate Chiropractic with me, and Dr. Eric is going to give some of the senior population some advice on how we can handle and deal with day-to-day living to protect our back and our spine, because typically at this age, as we get a little bit more mature, when we thought we were invincible as youngsters, we've done all the wrong things in lifting and handling, and now we're paying the price. So Dr. Eric is going to kind of give us a little help as to what we can do to make life a little bit easier for us. But first of all, I want to thank you again for coming today. And also, I just wanted to know what got you into this, how long you've been doing the chiropractic.
Well, thanks for having me, Cindy, very much. I got into this, I'm 33 years in practice now. When I was in college playing baseball, I had a back injury that was not really relenting. I'd go to physical therapy, go to see the trainer, get back playing, hurt it again, and that cycle was kind of repeating itself. And I ended up at a chiropractor's office through the recommendation of my coach, and had very good success. The injury was taken care of. I was back on the playing field. And in that conversation, he asked me, what were your plans after college? I originally planned to go to medical school, be an orthopedic surgeon. I had interviewed at Upstate at that point in time. And in his talking to me, he said, "Did you ever think about being a chiropractor?" And I said, I really didn't. And he says, "Well, why don't we go to lunch?" So he took me to lunch. We talked about chiropractic and what it would mean as far as a career in comparison to being a medical doctor. And at the time, there was probably a lot of advantages, because that was back in the day when the orthopedics were still had to be on call, had to do rounds at the hospital. They weren't out of the hospital setting. So there were some advantages. I started thinking about it, looking into it further, and next thing you know, I ended up at Chiropractic College, and that was out in Davenport, Iowa, at Palmer College of Chiropractic. Prior to graduating there, I worked for a doctor in North Carolina for 6 months. I had done all my requirements at school ahead of time so that I could do that. He tried hard to convince me to stay in North Carolina, and I decided I wanted to come back. I'm from Oswego, New York originally. Came back here and opened my practice in Baldwinsville in July of 1991, and here I've been ever since.
Ever since.
And loving every minute of it.
Wow, we're glad to have you. Now, can you tell us, I know it's a different, they talk about adjustments. All right, what is an adjustment?
So an adjustment, when people come to see us, we do a thorough evaluation to start. Many times we'll take x-rays to have an idea of what's going on in their spine as well. And then once we figure out where their problems lie, the treatment that we give is what's called a chiropractic adjustment. And what that truly means is they have a vertebra or more than one in their spine that is not moving the way it's supposed to. When that spine, that particular vertebra stops moving, that's called, the fancy word is a subluxation. All that means is your spine does not move freely and it is putting pressure on your nerves. Once that pressure is on those nerves, eventually you're going to get symptoms: pain, tingling, numbness, burning, some symptoms. When we adjust you, our goal is to restore the motion to your spine, to that particular area, get it moving, and by getting it moving, that reduces that pressure, removes the pressure off of the nerve, and allows your body to work the way it was designed to work, which is free of any nerve pressure. Typically, when we adjust a patient's spine, most folks have more than one subluxation in their spine, and reason being is gravity is pushing down on us with regularity. We also have traumas throughout our life, falls, sports injuries, car accidents, etc., that play a role in. And as much as we'd like to think that we escape those issues, they're there, and they show up a lot more as we age, as we mature, as you said.
You are absolutely right. Yeah. As we mature, yes. And like I said earlier, when you're young, you don't think about lifting with your legs. you bend over, you pick it up, and you don't think about it. Well, you do once in a while because somebody may yell at you. But for the most part, when we're younger, we just do it. And you don't think about it.
100% correct. And it's those things, all those times that we did it, it's really those cumulative traumas where we didn't notice an injury, didn't notice any pain, that lead to the one episode where we finally have that.
Yes,
it's
we do.
really the straw that broke the camel's back, in essence.
Well, I know I had to probably abuse myself for many years, and one day, I don't even know what it was. I think I just turned, and down I went. Down I went. That was...
And that's how it happens.
Awful.
That's how it
was
happens many
awful.
times, and it's no fun.
No, it is
No.
not. I mean, I don't think I've ever experienced pain like that because I thought, well, these guys are, everybody's, they're not really doing that bad, come on. And then it happened.
Till you have it.
Then it happened, and I said, oh, now I have to start paying attention. And I'm sure some of the damage had been done at that point.
Oh, for sure.
But I try to, follow the rules after that. So that being said, as far as with people of a little more mature age, what can we, as those more mature people, do to help keep us on the right track regarding our back and our spine? Just things at home.
So the first thing those folks who are more mature could do is keep moving. Number one, the more you move, the better you're going to do. The less you move, the more problems you're going to have over time. Because again, as I mentioned before, gravity is constant, not going away, compressing you towards the earth. So if you're not moving, you're becoming more stationary, and the less motion in your body, and that's not just in your spine, blood flow, etc. All those things benefit from movement. So the more you can move your body, just in general, getting up and moving is going to help immensely, number one. Because obviously, as we know, seniors many times get too sedentary, and that causes lots of problems throughout our body. Our body wants to be in a state of motion, and we need to foster that. That's number one. Number two, regular exercise is going to be vital. So, and that doesn't have to be intense. It can just be walking. It could be riding a stationary bike. This time of year we're not going to be out on the road anywhere, but walking, a stationary bike, a treadmill, anything like that would be very beneficial. You've seen even I get asked the question all the time about the little pedal bike that's in your living room where you're sitting and pedaling. That's still going to be good. It's still beneficial. You're still getting some form of exercise. So any exercise is going to be beneficial, number one. What I suggest to all my senior patients that can do it, and we have them start actually on their bed, is get on your bed on your hands and knees and just practice getting up. Reason being is, what's the number one concern we have for seniors, right, is a fall that ultimately would lead to a fractured hip and then leads to pneumonia, which then leads to you being off the planet. So the best way to avoid a fall to begin with is to have a strong core. A great many of my senior patients, their number one struggle would be getting off the floor, right? And many live at home still by themselves. So the best way to figure that out is get on the floor, but like I said, we have them start on their bed and practice getting up. Crawl over to a chair and then get up, and do that several times a day, because that is going to benefit your core strength and allow you to be able to get yourself up off the floor. A big problem with folks 80 plus is now they've fallen down, and if they don't have family members checking on them regularly, they may be there days.
Yeah.
And that's a concern. So the best thing we can do for ourselves is keep this core strong by regular exercise. Practice, get down on the floor and just practice getting up. Now, some folks are going to have bad knees, but there's ways around that. You can even orchestrate where you have pillows on the floor and use a chair to help you get up. There's YouTube videos on this that you can look at. Very, very beneficial, but keep moving, exercise regularly, and definitely practice getting up. So all the things that we think about that when we were 40 come naturally and are easy, and when we're 80, all of a sudden are a challenge, like getting off the toilet or getting off the floor or getting out of bed. I just had a patient this morning ask me, he's 91, and he said, last week I sat on the edge of the bed, kind of got my bearings, which I always do, and then I got up right away and immediately collapsed to the floor. He didn't get hurt, which is good. His wife helped him get up and he got things together, but he wondered why that happened. So why would happen, and this happens with seniors a fair amount, he sleeps with his bed a little elevated. So he's getting lots of all the blood pooling in his lower extremities. And when he goes to get up, now his whole lower extremities, both lower extremities are full of blood. So his muscles can't react, and down he went. So a very simple thing that I had him do is just from a seated position, all I want him to do is not get up in total, but just make that move before he even thinks about getting up.
A little
just
practice
a
run.
little practice run, 5,
yeah.
6, 7 times, get those legs motivated, get that blood flowing back towards the heart. So now he's not having all this blood pooling in his lower extremities, and then he's going to be up and ready to go. And
I never even thought of it like that.
And until it happens to you, you
Well,
wouldn't, right?
Now let me ask you this: as far as what do you recommend as far as in your bed? A pillow, a hard mattress, soft mattress, no pillow?
Medium to firm mattress.
Okay.
You certainly don't want too soft,
Right.
because you want it to support you. Pillow-wise, 1, not 2, because a huge problem for seniors is head very forward, right?
Yep.
Because what happens as we age, we lose what's called proprioception, which is our ability to sense where our feet are in space, meaning knowing that they're on the ground. Which is why seniors, as they age, are losing their balance, and they're forward because they also want to see where they're going and see their feet. Okay, so their head keeps drifting forward. It's vital that you keep that chest high and that head up. Reason being is this spinal cord, which is directly attached to your brainstem, will receive tremendous damage from that head being forward. Now we're seeing this in the younger population due to cell phones and tablets and computers. Everybody's head is getting out here, and it's causing all kinds of health problems. Seniors already were having those, so I'm constantly talking to my senior patients about keeping that chest high, keeping that head up and the chest up, because that's going to allow several things. Number one, much better neurological flow from your brain down to the rest of your body. But also, you're going to have better balance, because when your head gets out in front of you, now your center of gravity is way off.
Right.
Because your head and your pelvis are following each other, trying to sense that center of gravity. And that's why seniors start to struggle greatly with balance too. So the more you keep that chest up and keep moving, your balance is going to be better. Your chances of a fall are less, for sure.
I remember reading something on Facebook, and if it's on the internet, it's true, right?
Well, of course.
Yes. Where it said, and I found it very interesting, where it said sitting, just sitting. You're talking about just sitting and not moving, and with the remote. Sitting is the new smoking.
Totally true.
I was shocked.
Totally true.
And I said, I'd seen my surgeon after that, and I said to her, we both said it at the same time, because she was, that's how they're looking at it too. They are looking at it from a different perspective, the actual surgery. You're looking at it from the spine and wellness area in the back.
Exactly right. Exactly.
Sitting is the new
Very much so, and this is why you're seeing the advent of sit-stand desks.
Right.
Like when you come in my office, all my staff have sit-stand desks so that they can stand for a portion of the day. If they have to sit, that's fine too. I have them. My nephew, Dr. Ted, has one. All because it's vital that you be up and moving, and then it's not that we want to stand all day, but we need to be standing some, sitting some, and just changing that position, as opposed to here all day long and your body is compressing, gravity pushing down on you, causing problems. So
I know, and then as I'm sitting here talking, I'm thinking,
yeah, your posture comes up all of a sudden.
is he going to notice all of a sudden my posture here? Because I pay attention. If I'm sitting watching TV, I try to keep going, because I have learned and I pay attention. But when I'm sitting there, I'll start out real good. And then the next thing,
Then you're slouching all
yeah,
the way over.
it's terrible.
Yeah, exactly.
It's terrible.
Well, you are a shining example. One of the best things for you and all seniors, for instance, women and men who love to garden. It's a fantastic form of exercise.
Well, your
And
mom does that too.
My mom
How-
does
how
that
old is
without
your
a
mom,
doubt.
or
My
we don't
mom's
wanna-
81. No,
Okay.
I'm happy to share.
Okay.
One of the things I encouraged her to do is I bought her knee pads and said, Mom, get out there and crawl around your garden. You love working in the dirt. And she does, and she said after I made that change with her, because like most, she used to just bend over and do it, and then she would complain to me that her back was bothering her. And I said, listen, crawl like a baby, dig in the dirt. And she said, wow, my back doesn't hurt anymore when I do it that way.
Wow.
And I said, well, because we're generational, there was a time when it wasn't appropriate for a woman to be crawling through her garden unless you were the wife of a farmer.
Right.
But now we understand
The importance.
it's way better
Yeah,
for
right.
you, because that gives you the curvature to your spine that your body needs, that good lordosis, this type of a curvature, number one, but also it's a better form of exercise because, again, you're engaging your core when you're down there crawling, as opposed to doing something negative where you're flexing from the waist, which is the last thing we want to do, because that is what causes those disc injuries, especially when you have degenerative arthritis, which we all do once we're literally past the age of about 30.
Oh, 30?
Well,
Wow.
our spine actually our body stops growing about age 21, our growth plates close. So what we tend to forget is that pretty much from age 21, our body is declining.
We're on the downside,
We're
huh?
declining from that point on. And so the more you can do as you age, the better you're going to be. And one of my big caveats that I throw at my patients all the time is, does it make sense that as you age, that you do less to be healthy? Of course not, right? Because your body is declining at a more rapid pace as we age. So we should actually do more. We should make sure we're moving more, exercising more, make sure we're reading more to enlighten our brain, keep us mentally sharp. Exercise regularly, see the appropriate providers that we should see. If you go to a physical therapist, go see them. Don't wait. If you go to a chiropractor, go see them. Don't wait until you have that moment where you're incapacitated.
You're in trouble.
Exactly.
Right.
Avoid that. And then when you get healthy, what I talk to folks about all the time as well is, if you're going to the gym regularly because you want to stay healthy, you don't reach a point in time where you say, okay, great, I'm really healthy now, I'm going to stop going to the gym now.
Right.
Right? We wouldn't do that.
No.
And same thing
That keeps you healthy.
Exactly.
That's right.
Same thing, if you're trying to lose weight and you're eating better, you don't reach that magical point and say, okay, well, now I'm going to eat whatever I want from this point because I got to that point. We know it doesn't work that way. So do more as you age to maintain your body and keep you going in a much better direction. And then you can get to 100, 90, 95.
And still be functioning and still be
Exactly, and still
able
living
to
a full
enjoy.
life.
That's
Exactly.
right. That's right.
I mean, that's really what we want, isn't
Right.
it? Is to enjoy our time here. None of us wants to be living in some assisted care facility where we can do very little.
Right.
Because
You're
that's
absolutely
that's the reality.
Yeah.
It's a possibility.
So, all right. Well, thank you.
Quite welcome.
That was
Quite
was
welcome.
very interesting. I mean, I've known some of those things from you and from others, but and I try to pay attention and do that type of thing. But as far as you're concerned, what would you say the number one thing is? It keeping active?
The number one
moving?
thing is definitely keeping active and keeping moving. What studies have shown as well is those folks who are more active are more mentally engaged. They're more sharp. Their brain needs that movement of the body as much as anything else. And those that move less, that's when things will start to drift away here because you're just not engaging the body. When you're moving your body, your central nervous system and your brain is engaged, and it's so that you can say, oh, okay, we've got to do this. And it's like anything else. If you're stationary, everything's working much more mildly. If you're moving, now your body is much more engaged, and time is saying to you, okay, we can handle this. you're sending a very clear signal that you want to stay on the planet.
Well, I do. I do.
Exactly.
And that's good.
Yeah.
For hopefully for a lot more years, and a lot more years where you can be comfortable in doing the things that we all want to do.
Absolutely.
That we all want to do.
Absolutely.
Well, thank you very much. I
You're very
appreciate it.
welcome.
And you've given me some great advice, and I hope that you pay attention, because I think a lot of this is very, very, very meaningful, what Dr. Eric has said, and it's not rocket science. It's not difficult to do. It's day-to-day living and taking care of yourself so you can enjoy life better, longer, and have a more enriching time.
Exactly right.
Absolutely.
Exactly.
But anyways, thanks again. I appreciate
You're very
it. Have
welcome.
a wonderful day. Bye, PAC-B TV.
Bye. Thank you, Cindy.